Okay, hey everybody, I am Dr. Brady Wyrick, from here from Sensor Medica. I'm the Director of Regenerative and Integrative Medicine here, and what I want to share with you today is our clinical protocols that we use when we use shockwave therapy. So keep in mind, these are our clinical protocols that we've developed, and they're exactly that. They're protocols, but they're not cookie cutter. They're not one size fits all. This is basically a starting point for you as a clinician to determine what your patient's needs are on an individual basis. This is just where we start with most of these particular conditions. So first off, let's talk about peripheral neuropathy. This is how we do peripheral neuropathy. For the first 3 applications, we're going to use 500 pulses per foot at 70 millijoules and 18 hertz. We do it this way because peripheral neuropathy patients have a tendency to be a little bit sensitive, and if we overdo it with them, it can actually hurt the first couple times that we do this. We don't want to do that. We also do it this way because if we're right, then it's actually going to get them better pretty dang fast. So for the first 3 applications, that's what we use. Then after that, we use 1500 pulses, 900 millijoules, at 22 hertz. So we do that for 15 to 18 visits. If their numbness and the neuropathy symptoms go up to the knee or past, then we will also do the confluence there of the tibial and the common peroneal nerve at the back part of their knee. And with all these cases, I always put in here too that we use setting 4 on the Giga laser. Shockwave is a great standalone therapy. Shockwave and laser in combination with each other are a pretty unstoppable force. So I put those in there as well. So with the Giga laser, you can see what setting we use. But with each one of these particular conditions, I also put in here the custom dynamic orthotics are a must. For peripheral neuropathy, of course, we want the feet to be on a nice level surface. So osteoarthritis in the joints. So we use 2,000 pulses with 70 millijoules and 15 hertz for the hip. Since it's a bigger, deeper joint, we'll increase that to 90 millijoules to reach in there a little bit deeper. In 12 to 15 visits, we follow that up with setting 3 on the Giga laser. So with the lower extremity or with backs, we do that the same. But when we see lower extremity in people with back issues, then of course we do the custom dynamic orthotics that we do here in-house with those as well. And also I'm going to put in here when we do regenerative medicine and we do stem cell exosome injections, these are the same settings we use post-injection, and we'll start doing these 1 week after their injection to help them to heal faster. And of course, if someone has an osteoarthritic knee, for example, we do want them on an orthotic to level the playing field per se. So that's osteoarthritis, and there is a PDF of this that we'll include so you can actually see this in writing. And then plantar fasciitis. This is 2,500 pulses at 90 millijoules and 10 hertz for 12 to 15 visits. They'll see results in the first 3 or 4 visits and then continually improve after that. We also use setting 2 on the Giga laser, and the way I say it to patients is, plantar fasciitis, this is going to get rid of the pain, and then the orthotic is going to keep it from coming back. So those are a must as well. And last but not least, I put in here Achilles Tendonitis. This does not just apply to Achilles. This can be a tendonitis in pretty much any joint, but the tendons, the settings that we use are 2,500 pulses, 70 millijoules, 10 hertz for 10 to 15 visits. And of course, we put in there custom dynamic orthotics are a must. So those are the settings that we use. We thank you. And if we can be of any assistance to you, please feel free to reach out to us. Thanks a lot.